Good morning to Madam Christina. My name is Emily Yek Ining with my case number 79311. I'm the group leader of Group 7. Today our topic are does education influence healthcare in Malaysia? Before I start, I'm going to introduce my members first. They are Nurul Aini Shahira, Doreen Tingnuin, Noor Fazila, and Johansson. Education is an agent of social institution. The words social institution is stand for a group of individuals who have a common purpose or goals. While through Cambridge Dictionary, education means the process of teaching or learning, especially in a school or college. While healthcare, it means the activity or business of providing medical service. Education is divided into three, which are formal education, informal education, and non-formal education. Normally, formal education will begin in primary school, which the students will be taught by trained and qualified teachers. While in formal education, the children are learned from home or elders. They will learn about their cultures or their mother tongue language. Not only that, there will also be some of the dialects. For the example of non-formal education, there are fitness programs, swimming classes, singing classes, or even dancing class. The purpose of education in healthcare is that the healthcare providers can provide better healthcare to the patient, and they can gain trust from the patients so that the patient or clients will give enough cooperation to them, and they can know how to interact with dying patients or their family members. Not only that, they will have the knowledge to create new technology or machine. Last but not least, they will know how to educate people so that the people can follow the instruction well. That's all from me, and my members will talk more about the relation between education and healthcare.
Hello everyone, my name is Nurul Aini Shahira binti Rosli. Today I will present about benefit of education in healthcare. Firstly, education can help healthcare provider to gain trust from patient. Patient trust is the one of the most vital aspects in smoothing clinical practice. In this regard, trusting the healthcare professional has been suggested to be the main idea for effective treatment and fundamental for patient-centered care. Well-educated or professional healthcare workers are likely to receive higher trust in no time. This is because the nature of how we interpret and judge certain situations to adjust to our interests. However, it is difficult to gain trust from the patient, especially if the patient admits to the hospital for the first time. There are other examples. When a client had received treatment from the same doctor, it is hard to build rapport and trust other doctors. However, if the doctors or nurse are well educated, they will act professionally in their and communication so that the new patient will not have doubt with their decision. There are some examples on how to gain trust from patients. First of all, we need to communicate often and well. Effective communication is a key element for building trust with your patient. For example, in behavior science, we have learned eye contact during communication is necessary. Be engrossed when patient is describing their symptom or pain and use fewer professional words to reduce confusion. Next, in professional nursing, we learn to appear calm, competent, and in command of any situation. We should not be emotionally overwhelmed when in contact with patient. Your assurance serves to reassure the patient that everything is well. Lastly, education teaches healthcare providers the importance of keeping their word. Ultimately, education helps healthcare providers to gain trust and respect from patients in healthcare. That's all from me. Thank you.
Hi, my name is Doreen Tingnuin. My matrix number is 79439. I will start my presentation. In addition, people who are more educated are more professional in caring for dying patients. This is because in the hospital, it is a normal occurrence for the healthcare providers, such as nurses and doctors, who experience people dying. Before they can become a healthcare providers, they have professionally learned in the university or college on how to take care of the guide patients and to comfort their family members. For the nurse, we have been taught to take care of the guide patient holistically, not only about the illness but also their mental health. When we are facing guide patients, we must be professional and respect the guide patient and their relatives. Besides that, the patient culture and beliefs, values, preferences, and outlook of life should be respected as well. We need to always listen to what guide patients have said, respond to them, and provide emotional support. Generally speaking, people who are guide need care in four areas are physical comfort, care and emotional needs, spiritual needs, practical tasks. Normally, someone who is alert at the end of life, either capable, feel depressed or anxious. Healthcare providers who are educated can always comfort the relatives, especially their mental health, and we must also give them emotional support. Healthcare providers can always provide a soft lighting in the room for the guide patient and play music at a low volume for relaxation and lessen pain. As a healthcare provider, although communication with the patient is not as effective, we need to always be there for our guide patient and their relatives so it will not be as miserable and lonely. We will also be able to guide the patient relatives in grieving. In a nutshell, education led ones could be more professional in giving healthcare to guide patients. That's all from me. Thank you.
Again, my name is Emily Yek Inin with matrix number 79311. Through education, a healthcare providers can be more innovative and creative in creating new technology to improve the healthcare in Malaysia. It is because they can more understand the lack or needs of patients in the hospital. For example, Dr. Jong Tang Inchin, he is from Raja Medical Specialist Center Sibu Sarawak. He created a thing called hammock wheelchair. The uses of this hammock wheelchair is to transport patients from a hospital bed to a vehicle. It can carry patients who weighing 100 kg or more. It can also reduce injuries of nurses. This is because, through statistics, there are 35 to 80% of nurses that suffer back injuries when lifting patients onto a conventional wheelchair. Furthermore, there are also 3D printing machines that are used widely in Malaysia. The uses of this 3D printing machine is to custom and create blood vessels, organs, tissue, or even materials they want to use to help patients. Doctors or surgeons that can utilize the plasma of humans from patients to create an invention of human skin, especially for burn victims. In some cases, there are patients who have serious injuries in certain organs, for example like kidney. So the doctors will use this 3D printing machine to create a SAM kidney and discuss with other healthcare providers about the outcomes or effects of this patient after undergoes any medication or surgery. Thank you.
Hi, my name is Nurfazila and my matrix number is 80761. Last but not least, a high educated healthcare givers will know how to educate patients to live a healthy lifestyle. According to the World Health Organization, non-communicable diseases, specifically ischemic coronary heart disorder and stroke, remain the main reasons for demise amongst human beings globally for the ultimate 15 years. This is associated with humans' unhealthy behaviors such as no longer adopting a wholesome way of life, unbalanced diet, and lack of exercise. Through education, healthcare providers will understand the effect of this unhealthy lifestyle and they can educate the patients after or before discharge. Moreover, when healthcare givers interact with patients who have eating disorders like bulimia, anorexia nervosa, and binge eating, the patients will be more serious when listening to the advice because the words from them are more convincing than unprofessional ones. For example, in Offer 3, a China variety, there are 8 intern doctors give education to the society about the importance of compliance to their medication, especially antihypertensive drugs, and how to prevent heart diseases. At the end of the campaign, many people just realized It is wrong to stop taking medicine without a doctor's prescriptions, although they are getting well. Educated healthcare providers can also teach patients' families about proper ways of taking care of an also family at home to prevent the wound from getting worse. Finally, it is important for the healthcare givers to be educated so that the advice or knowledge given to the society will not be wrong and will not harm the patient. Thank you.
Hi, my name is Johansson Anak Joseph and my network number is 78092 and I will start my presentation. To conclude, every healthcare provider, especially nurses, need to try their best to get higher education to improve healthcare in Malaysia. However, learning styles are changing or evolving nowadays. Ours is the era of adaptable e-learning for lifelong learning. It is essential for every healthcare provider to have improvement and change that does not only rely on the traditional style in providing healthcare. E-learning through YouTube or Google enable us to obtain information and knowledge immediately at their workplace, allowing each member to provide safe, efficient, and high-quality patient care. One should also learn digital literacy skills, which means they are skilled in using new technology or applications such as smartphones and laptops. Take an example. Healthcare providers can use Redlands app to detect malaria parasites, giving a simpler yet more accurate malaria diagnostic test. It may also do blood counts and diagnose anemia by comparing the amount of normal red blood cells to the number of red blood cells damaged by malaria parasites. In closing, healthcare providers should not be afraid to learn something new to become a great competent one day. There is a quote by Nelson Mandela: education is the most powerful weapon which you can use to change the world. This is our group references.
That's all from our group. Thank you.